Okay, this is Scott Allred again with Don Allred Insurance. Today we're going to be talking about health savings accounts. I get the question all the time, what is a health savings account? A health savings account is a type of account that the government allows you to open up if you qualify by having a high deductible health plan. You'll see a lot of people refer to these as high deductible health plans, HDHP. So you'll see that term a lot. Well, what does that mean? That means simply you have one deductible for your policy. It does not have a copay for office visits. It does not have a drug card. You simply have a deductible to meet. Once you have met that deductible, your insurance will either pay 100%, 80%, or 50% depending on the type of policy. These policies are great for premium savings. They really can get the premium down because you don't have all the bells and whistles of a copay plan. It's actually what I have, and I've been on it for 5 years. Really enjoyed it because of the tax advantages that you get. The government has an amount that each person can put up into the account per year, and it varies from year to year. For 2013, you're looking at $3,250 is the amount that you can actually put into an HSA account. If you're over age 55, you can put an additional $1,000 in. It's called the catch-up contribution, but we'll get into that later. Basically, with a HSA policy, you are getting the benefit of the insurance company's negotiations. So instead of paying the full price for a doctor visit like you would if you had no insurance, when you have an HSA plan, you will pay only the contracted amount. So for instance, if the doctor charges $150 when you go into the doctor, well, under an HSA plan, if the insurance company has negotiated that rate down to $65, then that's all you'll be responsible for. Same thing with prescription drugs. You will only pay the insurance company's contracted amount for that prescription drug. So obviously generics is a better choice if you want to save money. So with the HSA plans, they do cover preventative at 100%, which is great because a lot of people are just looking for a catastrophic type plan, but they still want to go out and get their physicals every year. So females, pap smear, mammogram, all that's going to be covered. For children, well child baby care, immunizations, those are all covered. And for males, of course, the regular physical would be covered. The great thing about the health savings account, though, is you can put this money into this health savings account. You're going to be able to write that money off, and then you're going to be able to use those funds to pay for your insurance expenses. So, for instance, you go to the doctor and the office visit is $65, and he or she ends up writing you a prescription for a generic drug that's $20. Well, you can go to your bank, deposit $85 in your HSA account, pay that to the doctor for the doctor visit, $20 to the pharmacy. You just had an $85 tax write-off. So these plans are really changing the marketplace today. Of course, healthcare has gone up so much, and copay plans are just really expensive. So this has been a really good product for us to sell. Now, we're not going to be able to get into all the information on this video, of course, but a lot of clients, what I like to do is set up a one-on-one appointment with them, go over all the advantages of the health savings account, because you can use the health savings account for non-insurance related items. For instance, let's say that you don't go to the doctor but 2 times, but you've put in $3,000 into the account. The money's just sitting there earning interest. Well, what can you do with that money? Well, if you have some dental expenses, you can use the money from the HSA account to go towards those dental expenses. Vision, if you need glasses or contacts, you can use the money in the account that goes towards that. If you have a long-term care policy, you can use the funds in the HSA account to actually pay the premiums on those long-term care policies. Now, one question we get a lot, which is what I wondered too, was, can I use the funds in the account to pay for my insurance premium? No, you cannot do that, nor can you use the funds in the account to pay for anything cosmetic. So if it's cosmetic surgery, if it's vision cosmetic or dental cosmetic, you cannot use the funds in the HSA account to pay for that. But these are great saving tools, can really cut down on your insurance premium. So if you are interested, please give us a call at 336-584-2705, or you can go online at www.nchealthagency.com to find out more. We sure would like to sit down with you and show you how HSAs work and see if we can get your premium dollars down. Thank you.